Welcome. My name is Peter Strong. I am a professional psychotherapist specializing in mindfulness therapy, which I teach over Skype for working with emotional problems and also addictions. So if you're interested in online therapy to help you overcome your addiction and to recover from addiction, then please go to my website and learn more about the mindfulness therapy approach that I have developed and schedule a session with me over Skype. So for most people suffering from substance abuse and particularly alcohol addiction, which is what I mostly work with, there are always underlying emotions that are fueling that addiction. There's inner psychological pain that is the root of the addiction. People use alcohol to try and escape their addiction. This is the most common situation that I find. There is underlying depression, low self-esteem, sometimes tremendous stress, and very often some form of emotional trauma that is fueling that addiction. So to recover fully, you have to heal that underlying emotional suffering. And that is the focus of mindfulness therapy. It's a way of working with your emotions very directly, quite different than just talking about your feelings. So talk therapy has a place, but it's seldom really able to heal the underlying psychological trauma or emotional pain directly. It's too indirect in its approach. So we learn to work directly with emotions. And the first thing we have to do is really learn how to develop a conscious and non-reactive relationship with our emotions. We have to see the pain without becoming overwhelmed by it, without becoming identified with it, without becoming reactive. Addiction is simply a way of trying to escape this emotional pain. It's an avoidance reaction. In my system, it's defined as a form of behavioral reactivity. It's a way of trying to escape that emotional pain. And that's quite understandable, but it's not going to work. That's the problem with any form of avoidance. It simply prolongs the problem. And the same goes for many medications too. For treating depression or anxiety, they really are not addressing the underlying problem. They're just a form of avoidance. In mindfulness therapy, there is no avoidance whatsoever. We focus very directly on our emotions. We learn how to sit with our emotions without becoming reactive, without becoming overwhelmed. That process we call reactivity is habitual in nature. It's simply because we are not conscious. We become victims of our emotional reactive habits. That's the problem, much more than the actual emotion itself. So, overcoming that blind reactivity and identification is an essential part of healing, and that's a primary focus in mindfulness therapy. And the way we go about doing this and establishing some freedom from our emotional reactions is by meditating on those emotional reactions. It is no good whatsoever to meditate on the breath or some other object in order to try and escape your emotional pain. That is an improper use of meditation. Meditation should be for the purpose of promoting healing in the mind. And that's what I teach. That's the approach that I teach. It's quite different than conventional meditation, which is usually trying to escape the mind in some way. We're not trying to escape the mind in the meditation that I teach. We are trying to heal the mind. Therefore, you have to meditate on your emotions, on your thoughts, and on your beliefs, and on your traumatic memories, and anything else that is inhibiting your natural state of well-being, that is holding you back from living fully, that is impacting your happiness. So, in the mindful approach to addiction recovery, we learn to meditate on the underlying emotions that are fueling the addiction. We also work with the emotional impulses of the addiction itself. So, for example, to do this effectively, we would actually challenge ourselves to work with the addiction. In the case of alcohol, we do not advocate abstinence or some kind of complete avoidance of alcohol. That is, again, simply avoiding the problem, the underlying unresolved emotional problems that are fueling that alcohol addiction. So we might meditate with a glass of wine in front of us. We want to do that in order to get access to the impulses so we can work with them, but also those underlying emotions, the underlying inner dialogue that says, drink that alcohol and make it all better. The desire to escape is very strong. If we want to break free from that desire to escape, then we need to meditate on that desire to escape. There is no other way of breaking free from that internal emotional reactivity, and there's no other way to heal it other than to meditate on it and bring full non-reactive awareness to that emotion. We also need to develop a compassionate relationship to our internal emotions. That's what that emotional pain underneath the addiction needs more than anything. It needs your complete presence. It needs you to be present for that emotion with mindfulness, which is this very high quality consciousness that has these features of compassion and friendliness and kindness and non-reactivity. These are what promote healing. This is well tested. This is not speculation. This is fact. Those qualities, when developed internally, promote healing. Mindfulness promotes healing. So I will teach you how to do this in our sessions together. It takes a little training, but once you start taking this direct approach to healing your addiction, you will see results much faster than just talking about your feelings or trying to avoid them or suppress them or other escape behaviors. That simply is not going to work. You have to work directly on healing the problem underneath. So if you'd like to schedule some sessions with me, then please contact me via my website, send me an email, tell me about your specific needs, and we can schedule a session. I expect everyone that I work with to see substantial improvements after the first 3 or 4 sessions. Psychotherapy should not be open-ended. It should have very tangible goals in mind. So if you'd like to start with me, then please send me an email and let's get started on your recovery process. Thank you.